I'm sure that most people doing this course will already have a basic understanding of coronary anatomy. It isn't sensible, however, to begin taking you through an in-depth discussion regarding individual coronary arteries and their branches without you first having a basic understanding of the overall structure of the coronary circulation. This chapter is really just a brief recap of the coronary circulation before we go into things in greater detail. It's really important to recognise that when you're looking at a coronary angiogram, what you're actually looking at is the filling of the lumen of the coronary arteries by contrast medium, and not the actual artery or the arterial wall themselves. A coronary angiogram is probably more accurately referred to therefore as a luminogram, and therefore has limitations. It's also important to recognise that whilst coronary angiography remains the gold standard test for coronary anatomy, it also has its limitations. These limitations primarily have to do with image resolution, insofar as only vessels over a certain size can be seen. The microcirculation, which you can't see, makes up a huge proportion of the myocardium's blood supply, and it's actually functionally very important. It's important not to forget that the microcirculation exists, even if it's not seen on a coronary angiogram. It's fundamental in understanding a number of invasive functional assessments that are performed in the cath lab, and can explain a number of phenomena that you might see, including myocardial blush and acute no reflow, for example. In this chapter, we'll demonstrate this with a real case example.